Hello, hello. Good evening, everyone, and thank you for joining in on another episode of Protecting the Vision. This is our first webinar for the new year 2026, and I'm so glad to be the host for the National Optometric Foundation educational webinars this year. My name is Dr. Timothy Brown, a member of the board, the NOF board, and I am excited to share this month all about glaucoma awareness month. That's what the month of January is recognized for. And I have a dynamic guest speaker who's going to be sharing everything you need to know when it comes to glaucoma. So don't worry if you don't know what it is. We're going to break it down for you. So get some paper, share this link. If you're watching with us on YouTube or maybe a social media, share it with your family members so that they can be locked in on this great educational webinar that we're going to have here in this new year. Happy New Year to everyone. Happy MLK Day. This is a very special day, a day of service. So thanks to all of you who are out serving, who have been out serving today as we reflect and remember the Reverend Dr. Martin Luther King Jr. on this day as well. As I mentioned, we're going to have an important conversation with Dr. Lauretta Justin, and we're going to talk about glaucoma, which is often called the sneak thief of sight, sometimes leading to irreversible vision loss. So the purpose of this webinar is to prevent the loss of vision by educating the public, educating communities, okay? So our goal today is to empower you, to educate you, and equip you with the knowledge that you need so that you can recognize all of the risks and understand prevention and protecting the vision through early detection and eye care, okay? So tune in for our guest speaker. I want to first tell you a little bit about the National Optometric Foundation. We are a nonprofit foundation. We are here as a support arm, the financial arm for the National Optometric Association. We support the association. We support the student association in various ways. One of the ways we come alongside the NOA at the conventions and conferences each year and help do free eye exams for the community. Whatever state, whatever city we're traveling to, we find a way to connect with the community that's in need, underrepresented, underserved, minority communities. And we try to provide free eye exams. We partner with people like VSP who come alongside of us and they provide glasses. They cut the lenses for the glasses. So some people are able to leave that day seeing better leaving than they did coming to that community event called Serve Where You Go. And we'll do this again this year in 2026. We're heading to St. Louis, Missouri for the NOA conference. And I want each and every one of you to have your face in the place as we come together as the NOA family and come together to serve the community. I also want to let you know that we try to support the students that's currently in optometry school by offering scholarships to them. We try to support students who are thinking about going into optometry school, seeing optometry as a career choice for them. We also try to support the community by providing resources so that they can educate the people in their community. Also doing these webinars where we're having doctors serving and giving their time to educate the public on various topics as we're going to do tonight. We're also trying to educate communities that's underserved and underrepresented about the 3 silent killers of vision. And glaucoma, which is what we're going to talk about tonight, happen to be one of those 3 silent killers, as well as hypertensive retinopathy and diabetic retinopathy. So tune in. I hope that this educational webinar is impactful for you and your family and your friends. And I'm excited to go ahead and introduce our dynamic guest speaker, Dr. Lauretta Justin. She is the founder and CEO of Millennium Eye Care. She's an award-winning optometrist, speaker, advocate for lifelong eye and vision health. With nearly 2 decades of clinical experience, she is known for her compassionate, patient-centered approach and her commitment to early detection and prevention of vision loss. Thank you, Doctor. As the founder and CEO of Millennium Eye Center in Orlando, Florida, Dr. Justin, she leads a practice dedicated to helping patients protect their sight through comprehensive eye care, advanced diagnostics, and practical education. She believes that clear vision is essential not only for seeing well, but for living fully and independently. Dr. Justin's approach to eye care blends medical excellence with whole person wellness. She helps patients understand how lifestyle choices, such as routine eye exams, healthy habits, and early intervention, play a critical role in preserving vision, especially in conditions like glaucoma that often develop without symptoms. Dr. Justin earned her Doctor of Optometry degree with clinical honors from the New England College of Optometry, and she holds a Bachelor of Science in Biology from Montclair State University. She's a licensed and board certified optometric physician in the state of Florida. Outside of clinical practice, Dr. Justin is a speaker, an author, and community educator who is passionate about empowering people with knowledge so they can make informed decisions about their eye health. She's married to her high school sweetheart, James, and is the proud mother of 3 sons. And in her free time, she enjoys reading, singing, spending time with family, and shopping for shoes. Her quote is, "Clear vision isn't just about seeing clearly, it's about having the confidence and clarity to live life fully." Y'all give a round of applause as we bring Dr. Lauretta Justin to this webinar. We're so excited to have you on with us tonight, Doc. Thank you for serving on this MLK Day, and thank you for all the work that you have been doing in the optometry world over 2 decades. Welcome to the show.
Thank you so much. Wow. Wow. What a welcome. I'm so
You are.
excited to be here.
Yes, yes, we are excited to have you. We are excited to be able to talk to you. I want to thank you for saying yes to being a guest speaker on our educational webinar. I really do appreciate that.
It's my pleasure. And, I can't think of a better day to talk about protecting vision than on the day we remember Dr. Martin Luther King, who was very adamant about vision. So I think this is such a great time to talk about that topic.
Absolutely. You hit the nail right on the head. Thank you so much for highlighting that. Dr. King did great work in the community. He was a civil rights leader, and he's always going to be remembered. And I hope that his children and the leaders here in the world will continue to carry out, and us as community leaders will continue to carry out his dream, the vision that he had, and continue to fight that we continue to remember him for as well. So
Amen to that.
yes, yes. So it is also the first webinar for the year 2026, and we are in the month of January where we highlight glaucoma awareness. So we want to bring some awareness to those who may not know what glaucoma is. Sometimes people are like, hey, this is the first time I'm hearing this word, but it sounds important. We want to just dive in right now and give them some insights about what is glaucoma when they hear that word.
Yeah, sure. And I definitely hope you can hear me clearly.
Yeah.
Glaucoma is really a group of diseases. A lot of times people hear the word and think it's just the one thing, but there's different types of glaucoma. And what glaucoma does is it causes damage to the optic nerve. The optic nerve is what carries your vision information from your eyes to your brain, so your brain can interpret what you see. So when you have glaucoma, it can cause the pressure inside the eye to build up, and that can cause damage to the nerve. It's not always due to high pressure, but generally, with glaucoma, there is an increase in the pressure inside the eyeball. There is a fluid that nourishes the internal structures of the eye. And when that fluid doesn't drain properly, that it causes a pressure gradient. Like I tell my patients, just think of a balloon that just keeps filling up with water. At some point, that balloon will pop. But what happens if the balloon does not pop? It just puts pressure on the wall, put pressure in all the veins and arteries, and then that causes the nerves to literally suffocate, and you lose vision because of that.
Wow, that word pressure stands out. Pressure will allow you to know if you're going to, stand against the challenges that's coming towards you, or if you're going to fold. And in this case, you're saying if there's too much pressure, there's damage that can happen, and that damage can lead to a loss of vision. And
Absolutely.
and we want everybody that's listening to know we want to prevent that. That's why we're doing this educational webinar. We want to prevent the loss of vision. Doc, I mentioned earlier that sometimes glaucoma can be known as the silent thief of vision. It's one of the silent killers that the NOA and the NOF try to advocate for and try to make sure that we're educating the public about. Can you talk a little bit and let us know why is glaucoma called silent thief
So
of vision?
when people hear the word pressure, we start to imagine something squeezing. So you think you're going to feel it. If I squeeze your hands, you'll feel it. However, the pressure inside the eye doesn't usually cause a symptom. So you don't usually feel what's happening inside your eyes. So that's why we call it the silent killer of vision, because you don't feel anything. There's no pain, no redness. I have patients all the time come and say to me, my eyes are red, they're itching. Do I got glaucoma? And I'll tell them, no, you don't. And a lot of times people think that they're going to feel those symptoms when they do have glaucoma. And you don't. It just happens inside the eye. However, there are times with glaucoma you can have symptoms. If you do feel it, you get pain in your eyes primarily, you could get blurry vision. If you have those symptoms, they're usually pretty severe, and you know something is wrong. And it's usually a very aggressive form of glaucoma that causes those type of symptoms. But for the most part, the general type of glaucoma, which we call the primary open angle glaucoma, usually has no symptoms, and you don't feel anything until you've lost a significant amount of vision. And that makes it very dangerous for a lot of people.
Yes. So you are dropping some nuggets tonight because those who are listening, I want you to understand what Doc is trying to tell us there. One of the main things she's trying to tell you is that you should not delay getting an eye exam, even if you feel like you don't need glasses to see, because we do more than just give glasses and contacts out for you to see. We are concerned about the health of your eyes. Your eye health is important. So having a routine eye exam scheduled with your local optometrist is essential. And I can't stress it enough how it's important that you do not delay in getting on the schedule with your optometrist. Okay, do it today. Don't delay. And the reason why I keep stressing this is because between December and January, I've heard stories from people who are losing their vision because they waited and they did not go see their optometrist. And we don't
Absolutely.
want that to happen.
Absolutely. I have I had a patient today who
Mm,
came to see me today. And I'd seen this gentleman maybe about 3 years ago. And 3 years ago, I wanted him to come back so we can run some tests, because I was concerned that his pressure was too high. And he said, okay, I'd come back. But then life happened and he
yes.
didn't come back. So when he came back, half of his vision was missing on the right side. Because he tells me when I'm
Mhm.
driving, I have a hard time seeing the drivers coming on my right side. And so
Yes.
now he has lost half of his visual field. He can't see half of his vision. So if you imagine if you're looking at straight ahead and there's somebody right here and you can't
Right.
see like where my
Can't
hands
see.
is at.
Wow.
So he was really shocked, and it was really sad for me to say that
Yes.
we can't bring back that vision. It's lost for good. And that's why, like Dr. Brown said, you have to get checked, because that's really the only way you can determine if you have glaucoma, is
Yeah.
if we do your exam and measure the pressure in the eye.
Yes, guys. If you don't go, you don't know. You have to go see your optometrist. You got to go and get that eye exam. You need to call and get scheduled today. Don't delay it, because these stories are real. You just heard Dr. Justin tell you that she just had a patient in there, lost the vision, irreversible, and we don't want that to happen. Okay, we want you to keep your vision. We want you to see the beauty around you, and we want you to be aware. So tonight we're trying to equip you, and we're trying to empower you so that you can recognize the risk, and you can be able to be an advocate for family members who may be at risk of losing their vision. Get them scheduled. Get your husbands in. Always congratulate the ladies when they get an appointment scheduled for their husband, because the guys, we know you guys are dragging your feet. Even though you
Yes.
pay that insurance through your job, you're dragging your feet, getting into the doors to get your eyes examined. And I applaud the ladies. And again, on this webinar, thank you, ladies. Thank you for getting the guys in the door for their eye care needs there. Thank you so much. Please continue to do that. We have to do that, Doc. And
That's important.
it's like a community effort. They always say it takes a village to raise a kid, but it also takes a village to help us as men to take care of our health and everything. So thank you all
Yes.
for that help. So
And
go ahead.
that kind of brings me to the point of risk, right? Because that's one of the things that people don't really understand. People would say to me that, well, there's nothing wrong with I can see really good, and I'm really young, so I'm not really worried about my eyes. It's one of the organs that we really take for granted, is our eyes. We expect them to function, and we never expect anything to go wrong, and we never expect to get it checked. So people think that glaucoma really only impact old people.
Right.
Anyone over 40 is considered old by some people, not everybody, because I don't consider anybody at 40 old. Um,
Exactly.
but it's not necessarily true. That's not the only people that glaucoma affects, not just old people. It can happen to anybody at any age. You can be, I have some young children. My youngest patient with glaucoma is 13 years old.
Wow.
That's insane. So
Wow.
it can happen to anybody. And if you don't get it checked, this kid could have potentially gone blind if he was not evaluated. And he
Wow.
doesn't have any vision problem, doesn't wear glasses. That's another thing. People think that if I don't wear glasses, I don't need to get my eyes checked. There's more to vision than glasses,
Yeah.
than just wearing glasses. So if you have a family history of glaucoma, if you are a person of African, Hispanic, Asian descent, you have risk for potentially developing glaucoma. If you have diabetes, you've been diagnosed with diabetes, especially if it's not controlled, that can cause glaucoma. If you have high myopia, where your prescription is very high and the minus, you can't see the drive, and is a very high prescription, that puts you at risk for glaucoma. If you had an injury in the eye in the past as a kid, you had an injury because you were playing with the BB gun and somebody poked you with a pencil, that can cause you to develop glaucoma in the later years. So it's important to know your risk, and that's why getting checked is so important.
Wow. Thank you, Doc, for highlighting those risks and the group of people who should be aware about glaucoma, because often we know, the NOA, they already know that there are underserved,
Yes.
underrepresented communities. There are people that don't have access to healthcare, and we are trying to stand in the gap. And we're asking others if you want to partner with us and help us to stand in that gap and provide the service and the resources to people who are in need and communities. Please let us know. We welcome you, even if we're coming to your city and your state and you're not a part of the organization, but you would like to do something. Please reach out to us, because when we do this event, volunteers are all that we have. doctors, and they might be technicians, they might be opticians, or they may be just a friend of an optician. They're coming out, and they're coming out to help. And we will find something that you can do. If you don't know how to do it, we'll teach you on the spot, because we need that help. We need to provide the care to these underrepresented, underserved communities who do not have access to healthcare there. So thank you for highlighting the risk so that people are aware. I don't know if you have anything else that you want to say on that, but I do want to know as well. We talked about people having glaucoma and not being aware of that. So if you can touch upon that a little bit for us as well, I appreciate that.
When you do have, or if you start to develop glaucoma, it can be a slow, progressive disease. That's a good thing. That's a bad thing. It's a good thing in that if it's caught early, then we can stop damage to your eyes. It's a bad thing because if you don't feel it, you may just kind of let it go.
Right.
In the eyeball, there is about 1 million fibers in your optic nerve, and each of these fibers is responsible for a particular point of in your vision. And when you have glaucoma, you lose these fibers over time. Now, if you start with 1 million and you lose 100,000, you still have 900,000 fibers. You're not going to feel it. You're not going to even see it. But you've lost that 100,000 for good. And you don't really start having any type of vision symptoms until you reach like half of your nerve fibers. So by then, that's kind of half of your vision. That's when you start coming in saying, when I look straight ahead, I can't really see in the side. Or like one of my patients said, if I want to see upwards, I have to tilt my head because I can't just see anything up here because my field of vision is lost. So you may not know you know it. You have it because there are no symptoms you generally feel unless it's a severe type of glaucoma. And that type, those are more complicated. And coming in early is really the game because the earlier you come, the more we can preserve your vision.
Yes. Early intervention is key. Early
Yes,
detection is key. That's why I keep stressing about getting that appointment scheduled. I know somebody's listening. You've been putting it off, and I'm asking you today to make sure that you take the right steps to get in on the schedule of your local optometrist. Okay. Just make the phone call. You need to be on their schedule. You need to ask them about dilation, comprehensive eye exam, so that you can get the health of your eyes checked. As she mentioned earlier, even if you don't need glasses, get the eye
absolutely.
exam. We'll dilate you to check the health because we don't want these things to sneak up on you. We don't want you to possibly have family history of it and you just don't know it.
Yeah.
Sometimes there's a family history. And because we don't talk to family like that, sometimes we don't know it. So we can detect these things through an eye exam. And then we'll work with your primary care doctor to for the next steps, refer you to them if there are other steps that you need, if we find other things going wrong in the back of your eye that needs attention as well.
Yeah. And you're absolutely right in saying that even if you don't wear glasses or your vision is 20/20, you got 20/20 vision, it's important to get it checked. We don't just go get physicals because we're sick. We get physicals to have peace of mind that we're
Right.
healthy. And
Yeah.
that's why you should check your eyes to have the peace of mind that you have healthy eyes and confirm it through the testing. I can't tell you how many tumors that I've detected in my exams of healthy eyes who don't wear glasses. So you just never know. I mean, I could tell you so many stories. One of the stories that always breaks my heart is a 16-year-old boy who
Mhm.
we had seen again 5 years before and was concerned. Dr. Brown, one eye was 20/20, the other one was 20/25. And it was just odd. that they both wouldn't be 20/20. So we said, you know what, we want to do this test. Let's schedule an appointment to do a visual field test with mom. But he had 20/20 vision. It was not necessary until 5 years later when he came back and we do an exam. And then I said, all right, read the chart. He read the chart with both eyes open. And then I close the left eye. And he says, oh, I can't see. And I said, what do you mean you can't see? Your right eye is open. It was just one eye. He said, oh no, I gotta use both eyes to see. And I said, you can't see if I do this. So we did another visual field test at that moment. It was more like, well, we got to do this today. And
Yeah.
sure enough, he had a tumor. I had to send him to the emergency room right away. I called the
Wow.
hospital and I spoke with the pediatric surgeon. I told him, I'm sending you a very dire case. It was a terrible thing. He had a tumor the size of a tennis ball.
Wow. Incredible. Wow.
He didn't know. He's 15 years old. He's a kid. He doesn't know he can't see. And so you never know. That's why I think it's so important, even if it's, we're talking about glaucoma, but overall, it is important to do
Yes.
the screenings, whether
Yes.
it's your eyes, whether it is your physical. Those are important. And in our community, we are notorious for
Yes.
not doing
Yes.
those type of exams.
And in this new year, we want you all to make changes. Change the
Yes.
way you normally do things. No more procrastination. No more saying, I'm scared. Don't let fear hold you back any longer from making that eye exam. As you just heard, life changing decisions it could be for you. You may be the person that's having headaches a lot and wondering
Mhm.
why. Why am I having these headaches? Doctors can't find out why. You don't go to the doctor, whatever reason it is. You're taking over-the-counter medications, trying to get some relief from the headaches that you're having. When a eye exam, comprehensive eye exam, can be the key to detecting what may be going wrong overall with your health, not just with your eye health, but your body. As she mentioned, a tumor was located because this young man came back 5 years later for an eye exam. So don't delay. Get your eyes examined today. We're the National Optometric Foundation. We have a website. You can follow us, learn more about what we do. We have a Facebook page. Well, I'm asking you to go and like our Facebook page so that you can get notification about these webinars. And we're on YouTube, National Optometric Foundation. We have a Cash App if you want to help us continue to do the great things that we're doing in the community, for students who are in optometry school, thinking about going to optometry school, supporting them with scholarships, helping them get to the conventions, being a financial arm for the National Optometric Association. Please, you can send us $10, $20 tonight at $ protecting the vision, and we'll be so grateful to receive and to also distribute those funds and helping our next generation of optometrists and helping the community have those resources so that they can be educated about optometry, eye care, all of the things that can affect their vision. We have a great speaker on with us tonight, Dr. Lauretta Justin. She's been putting out some golden nuggets for us tonight. Thank you so much for what we've already discussed and the great things that you're going to continue to bring on this webinar tonight as we highlight Glaucoma Awareness Month. And we're highlighting glaucoma because it's a silent killer of vision. And we are striving to protect the vision. We're trying to prevent vision loss. So we are encouraging you to continue to tune in, but don't just keep this information for yourself. Share it with a family member, share it with a friend so that they too can receive this free education that Dr. Justin is sharing with us tonight. Thank you, Doc. I'm going to let you continue on talking about glaucoma, talking about the detection of glaucoma, because, it doesn't cause pain. Sometimes it doesn't cause vision loss until you're in the later stages, and also talking about how it can be managed as well there as we move along.
So To manage glaucoma, if once you get diagnosed that you have glaucoma, we have to properly identify which type of glaucoma you have, because some glaucoma are faster in how it causes damage than other types of glaucoma. So we categorize which type of glaucoma you have to determine what is the best treatment option for glaucoma. In my office, we look at eye drops as a treatment option for glaucoma. And the purpose of the drops is to control the pressure, as I talked about earlier, and bring the pressure to where it's more manageable for the nerve. It's not causing damage in the nerve. Depending on the patient, I may have them do a laser procedure as well to help manage the pressure, because sometimes that works for some patients as opposed to eye drops or in combination with eye drops. Those are usually the first two things that we consider after I have this conversation with the patients. So once I figure which type of glaucoma the patient have, I tell them what types of treatment that is available with our where we are right now in our scientific development. So I let them know we could do drops, we could do laser, but I always teach them the fundamentals of health and eye health and overall health in their care treatment of glaucoma. I teach this fundamental of health to every patient, not just the ones with glaucoma, but I always go through it, and that helps a lot of my patient. I call it Dr. Loretta's 4 pillars of wellness. I tell all of my patients, yes, I'm going to treat you with these particular drops. So yes, we're going to do this laser procedure. But then I want you to understand the fundamentals of wellness. And those are the 4 pillars of wellness that I talk to my patients about. And do you want me to go right into it, Dr. Brown, and tell you what the 4 pillars of wellness are for the patients? I will go right into it. Um, for for you to be healthy overall, not just in your eyes, and to support glaucoma treatment, if you have a family member, let's say you have a family member that have glaucoma, or your risks for glaucoma are higher, and you're thinking, what can I do to help myself if I'm at risk, or I have just been diagnosed, or I'm already taking medication? Is there anything that I can do? Because patients always want to know how they can contribute to the treatment that they're taking. So the 4 pillars of wellness really help works for anybody on how you can keep your eyes and body healthy. The first pillar is sleep. Sleep. I always ask my patients, tell me about your sleep. Because sleep is the number one repair mechanism that we have in the body. And it is the best detoxifier we have. Right now, I'm doing a detox. It's part of my New Year thing that I usually do a detox, but sleep is really the best detox that we have. And it's what restores our nervous system, including the brain and the optic nerve. So I'll always ask them, are you getting the 6 to 8 hours of quality sleep? I'm not talking about just falling asleep at 4 o'clock in the morning, getting 2 hours here and there. Are you getting some sleep? And it's one thing that is so simple that a lot of us could do, but that's very neglected by many, many, many people. And we don't realize that every time we reduce our sleep, we are stealing from our lives. We are cutting our lives short. The less we sleep, the shorter we will leave. We will live, not leave. Or the quicker, let's say the quicker we might leave, the less we sleep. So sleep is so important. And if you have glaucoma, I'm going to tell you the first thing you want to do is get the first 6 to 8 hours of sleep that you require. So number one is sleep in the 4 pillars. Number two is hydration. Is basically making sure you stay properly hydrated. Your body is 68% water. Your eyes is about, what is it, 80%, 78% water? The eyes, water is everywhere. So you need to stay hydrated. It helps deliver nutrients, it helps cellular function throughout the body, including your eyes. So I always say, do you drink water? About half your body weight in water is what you want to do per day, because dehydration affects everything in your body, including your eyes. We know about dry eyes, how it affects it, but when you hydrate yourself, you increase blood flow because there's just more fluid in your body. So drinking and staying hydrated with water is pillar number two. So, number one is sleep. Number two is hydration. Number three is nutrition. Is talking about eating the right foods for your body. There's one word I always teach my patients when it comes to nutrition, and that word is bio individual. What I mean by bio individual is you have to find the foods that will feed your individual body. Just because it's good doesn't mean it's good for you. I have people tell me all the time, I eat all my carrots to keep my eyes healthy. But believe it or not, there are people who can't eat carrots or are actually sensitive to carrots. I happen to be one of these people, which is rather ironic because I'm an eye doctor. But I am sensitive to carrots. So when you eat, we could talk about nutrition, the kind of food that's good, but I always tell my patients, your job is to determine and discover which type of foods nourish your bio individual body. So that's important because food provide the building blocks for health in your body. So knowing what kind of foods feeds you is very important. And that's the third pillar. And the fourth pillar is elimination. So we have sleep, hydration, nutrition, elimination. The body must remove waste. That's very important. And you eliminate through, I would say, pee, poop, sweat, and breathe. The number four is one of the ones we do not do. If you're busy, like I am, like Dr. Brown is, you have kids, you have your work, you have church, you have so much going on that you constantly going. And we all, a lot of us in the States really breathe short breath. We don't breathe long breath. And because of that, our bodies don't get the amount of oxygen. So we have a lot of toxins in our bodies. And if waste does not leave the body, it will stress the system, including your eyes. So I always talk about the fundamentals, the four pillars of wellness. What's your sleep like? What's your hydration? What's your nutrition? And it was what your elimination. That is the fundamentals I always start with every patient.
I love that. I love that. Yeah, I love even when I'm in church and the preacher gives us a 1, 2, and a 3. You got something to take home. So
Yeah.
we want to make sure that you guys take that message home and make sure that you understand, because people, we do not stress how important it is to sleep.
Yeah.
It's very important. It's very important if you can get a good night's rest, 6 to 8 hours, as you mentioned there. Sleep, getting the hydration, the nutrition, and elimination. Wow, that's
Yeah.
powerful.
And we all know we got to plug our phones at night, right?
Yeah,
Because once it dies, it doesn't work. It's the battery needs to be what?
recharge,
Recharged.
recharge.
And we also operate like a battery, actually. And we also need to be recharged. I didn't touch on this, and I'll briefly say it in the context of recharge. When I talk about nutrition, I always tell my patient there's primary and secondary nutrition. And when people hear the word nutrition, most people think of the secondary nutrition, which is the food you feed your body. But that's actually secondary. Primary is what you feed your spirit and your soul.
Wow,
That's the primary nutrition. And that affects glaucoma as well, because we are all one whole unit. And we're not separated, it all works together.
wow, that's amazing. That's powerful. And I when I get in bed, I try to let my body know that I'm here to rest. I'll elevate
Mhm.
my feet so I can take it even further from the floor. So it won't think I'm going to get back on the floor and start doing something. I'll elevate my feet, my legs, and my body feels so good to just be in that mode. And so this year, 2026, I am adjusting my diet this month as well. So congrats to you with going through your detox stages there. I'm moving into the no meat zone right now and putting more fruits and vegetables into my diet. So I'm trying to hang in there. This is the third week. So I'm pushing forward and then going to start doing adjustments to certain meats that I'm eating in February as well. Lean more towards fish
Mm.
and certain types of fish, as I incorporate meats back into my diet too.
Yeah, and that's important, and that's the concept of bio individual that I was talking about. I remember I had done a sensitivity test, a food sensitivity test, and I discovered why there are certain foods after I would eat them, I would just feel bloated. It's because I was sensitive to them. And there are some of them are maybe considered the good food. However, my body does not like those food. And one of them is salmon. And it is it's really good for you. Salmon is one of the best type of foods you could eat because of all it has, omegas, and we can go on all the things that's anti-inflammatory, all the things that it can do.
Yes.
But for some reason, because of the design of my digestive system, it wasn't having it. So when we hear people talk about the things that they do, I always tell my patient just because it's good doesn't mean it's good for you. So you
Right.
really
Right.
need to be very conscientious of what you put in your body and really listen to your body. If your body tells you this is not good, then it's not good for you.
Right. Listen to your body.
Yes.
What works for your neighbor may not necessarily work for you, or what works for your sister and your brother may not necessarily work for you. You need to find out, how to tailor certain diets and the nutrition that she mentioned so that it's just right for you. Because hey, there are certain types of fish, and the one that you mentioned is my least favorite.
Oh,
Uh,
really?
no, it has all of those benefits. It works well for my
Yes.
wife. She can eat salmon every week. She can have salmon. It works well for her. That's probably
Right.
what she's gonna have tonight. But uh, it's my least favorite, and I'm trying to get there and incorporate more of it into my diet. So in February, the F in February is fish. That's what I'm working on for
Oh,
the month of
cool. I like
February.
that.
Yes. So I'm working on each month, I'm working on something, whether it's eliminating all of the sweets and the sugars that we are incorporating into our body, our temple, and trying to eliminate those things coming in as well there too. So 2026, I'm taking a
Okay.
different pathway. And I want
That's
to
good.
encourage you all.
Yeah.
I'm not just putting this message out there for you to make changes. We're making changes. Healthcare professionals, if you're listening, you should join in on the change in 2026 and making sure that
Mhm.
you're around and you're available to help take care
Yes.
of your patients. That's important. Too often we do get busy, but we have to slow down and make the main thing. Make time out to take care of yourself. Self care is very important. Doc, sometimes when it comes to glaucoma, there are certain misunderstandings, certain myths out there. Have you heard of any of those things there? Can you talk a little bit about those?
Yes. One of my favorite ones is I don't claim it. That's my favorite myth. I mean, and I tell my patients, I get it,
No,
but it's
no.
claiming you. I know you might not claim it,
Right.
but it's claiming you.
It's got your
Uh,
name written all over it.
some of the myths are it happens to older people, and it's not going to happen to me. And I don't wear glasses. My vision is perfect, and I don't have any pain in my eyes. Those are some of the myths that are out there. And lately, because I did a video on glaucoma and glaucoma care, and we can talk about some of the supplements you can take for glaucoma in a minute. But one of the myths that I get is people think that if they take some magic, um, what is it? Castor oil,
Yes,
that they
the
won't
cure
get
to everything.
glaucoma. It's it's the cue to everything. My grandmother sure loved castor oil, and I'm not gonna knock castor oil, but it's not the cure to everything.
No, it's
And
not.
so people think sometimes that there's a magic cure, and they don't want to get checked because they don't want to take the medication, or they don't want to be put on medication, and they want to go to some natural type of treatment. And I do support that. I talk to my patients about natural approach to treating the whatever condition you have. However, sometimes people think that's all they need to do. They drink some tea and they think that's it. I just need to drink the tea, and that tea is going to help me with the glaucoma. You know, um, unless you get your eyes checked every whatever the regular time your doctor gives. My patients is usually between 3 to 6 months for glaucoma. You don't really know if the tea that you're drinking or the oil that you're putting, whatever it is, whoever has told you is working. So that's another one that I've heard a lot. People think there's like some kind of magic cure. And
And
that really brings me to the question, is there a cure for glaucoma?
yeah, let's talk about it. Is there a cure for glaucoma?
At this
Um,
time, not yet. Unless the Lord heals you.
there you go.
Which I'm a firm believer of that.
Yeah.
But we, as the medical community, do not have a cure for glaucoma. We do have ways to manage glaucoma and to protect your vision. And I usually tell my patients, once you get on the treatment, you are on it for life. Because the goal is your eyes are not able to manage this pressure by itself. So we need the support to help manage the pressure. And we got to keep doing this for your lifetime. And if we do that and you follow the protocol, most everybody can keep their vision for their entire life. It's when you don't participate and you're not compliant, that's when we get problems.
And I wrote down the word communication. Communicate with your doctor. Communicate and be honest. Sometimes we may have you on drops, and it's supposed to help lower your pressure. You come back in, we check your pressure, and your pressure is high. Sometimes doctors can think that that drop is not working for you, but in reality, the truth is you're not taking the drops, or you're not taking them regularly as you should. And that should be communicated to the doctor so that we can, reiterate how important it is for you to stay on a regular schedule, be consistent with taking the drops as prescribed versus adding another drop or switching you to a different drop. We want to make sure that you know that the communication between your doctor should be wide open. You should be communicating to them. They should be communicating to you. You should be able to ask questions to them. They should be able to
Mhm.
ask questions of you. We want to make sure that that gate is wide open. And if you ever get to the point, patience, where you can't communicate with your doctor, there are so many others out there that you can choose from. Okay. I'm not telling you to leave your doctor, but I'm also telling you that you need to make sure you communicate with your doctor. And if you can't build that communication with your doctor, there are others out there. You can get a second opinion, but don't just sit home and do nothing when it comes to your health and when it comes to your eye care. Because while you're sitting and waiting, we've heard tonight, you could be losing that precious gift called sight. And we don't want that to happen.
Permanently.
Yes, permanently gone. There's there's we just don't want you to wait. Don't delay getting your eyes examined. Don't delay putting yourself first. We understand you're taking care of mama, you're taking care of daddy, you got to run this errand for your children, but be sure to put yourself in the books. I tell the mothers when they call and they're scheduling 6 kids, seriously,
Mm.
they're scheduling 6 kids. And I say, Mom, thank you. We got your children scheduled. Now, what day can I get you in?
Mm-hmm.
Because it's important for you to come for your eye exam as well. So and they were like, oh yeah, I should get my eyes examined. Yes, ma'am, you should. You're on the insurance as well. So it's important for us as eye care professionals to make sure that we are encouraging the whole family to come in to get their eyes checked and examined. So thank you, Doc, for sharing about those myths and sharing about the medications that patients can take. And I just want to encourage patients, they told us this as a child: assume, do not assume. It still stands as an adult. Do not assume anything. Have the conversation, talk about it, and make sure you have an understanding of what's going on when it comes to your vision. Bring you some paper, write down some notes, because like I tell my mom, I was like, Mom, if I'm not there with you, have them to write it down, or you take some notes, because you may not remember, an hour from now,
That's
but
true.
it's important. If you're going to an appointment with one of your family members, you're the advocate for them. Take a notepad and take some notes so that you guys can go over that, and then you can explain it again to them, because they may not get it right then. And I
Mhm.
understand, before they go to the appointment, they say, oh, I'm gonna make sure that I ask the doctor about this and this, and when they get there, they forget,
They
or they
forget.
freeze up and they don't ask. And we want you to ask. We want you to know. We want you to know, so that things that could happen in a negative way are prevented from happening to you. We want you to be educated. We want you to be equipped. We want you to be empowered there. So that's why we continue to do these fabulous webinars. And our dynamic speaker has been doing a great job. As we're coming to the last few minutes of this webinar, Dr. Lauretta Justin, I want you to talk about any supplements or any advice that you may give when it comes to taking things that can help support the eyes and reduce the risk.
I always tell my patients the word supplement means it works with something else. So supplement doesn't stand by itself. It's supplementing something. So that's really important. But for your general health, there are supplements and vitamins that we should take because we don't get all the nutrients that we need from the food that we eat. So we supplement with vitamins and minerals so we can get the nutrition that we need. So I'll give you a few vitamins that you can take and supplements that will help for general eye health and glaucoma. Would start with vitamin B. A B complex is very important. B1, B6, B12. For glaucoma, B3. Most recently, there's been some research on B3 nicotinamide and how it can benefit glaucoma, because what we're discovering is inside the cell of the nerve, there is what we call the little powerhouse, what gives the cell the energy is called the mitochondria. And a lot of patients with mitochondria, and a lot of patients with glaucoma, their mitochondria is not working properly or is not doing what it's supposed to do. So vitamin B3 has been found to help the function of mitochondria, which can help in glaucoma health and reducing damage to the optic nerve. So B complex is very important. And before I go any further, I do want you to know I'm going to recommend certain vitamins that you can take. But because you are a bio individual, you have to talk to your doctor to know which vitamins would be good for you. Because just because it's good doesn't mean it's good for you. For food sources of vitamins or the B complex are leafy greens, eggs, beans, lentils, fish, and fortified cereals. They support nerve health, but they don't replace the treatment for glaucoma. The next is vitamin C. The antioxidant is very important. It helps maintain healthy eye tissue. You want to get to about 100 milligrams per day, depending on your particular needs. You can get those from oranges, strawberries, bell peppers, broccoli, and it's important to take it in. And sometimes people think if they take high dosage, it's going to replace treatment. A lot of times, high doses of vitamin C just kind of just flow right through you. So knowing what's the right dosage for you is important. You can take up to 500 milligrams per day, which is what I take. Vitamin E is also important. It's another antioxidant, and it supports eye health and eye tissue and keeps the eyes healthy. You can get it from sunflower seed, almond, spinach, avocado for vitamin E. And another powerhouse is omega-3 fatty acids that supports blood flow and overall health, including nerve health. 500 to 1,000, sometimes 2,000 milligrams per day, depending on your particular situation. Combined DHA, EPA. And you can get those from salmon, like we were talking about, flaxseed, chia seeds, walnuts for omega 3s. And then magnesium. Magnesium is very important because it improves circulation, including the optic nerve. Because if we can get circulation, blood flow to the nerve, it keeps the nerve healthy and functioning. So you can get that from spinach, pumpkin seeds, black beans, whole grains. Lutein zeaxanthin is another set of supplements that you can take that's good for overall eye health. Altogether, you can find those in kale, spinach, corn, and eggs. So if you make like an egg, scrambled eggs with spinach in it in the morning, you get a good source of lutein and zeaxanthin in there. And for glaucoma itself, nitric oxide has been most recently uh, something that's being researched, increasing blood flow in the eye. And what we're finding is that it relaxes blood vessels, improving oxygen and nutrients where we need it. You can get nitric oxides from beets, spinach, arugula. I can never say that word right. My French always gets in the way. And watermelon. So these are some of the vitamins and supplements that you can take that can help and supplement the treatment that you're receiving for glaucoma. Or if you think you might be at risk, these are some of the things you can do to reduce your risk for glaucoma. But they don't replace an eye exam and getting the proper care.
Wow. That right there makes me feel like I need to take up a collection for you. Wow, that's good information. That's good information. I mean, for all of you who are thinking about, supplementing, adding to, that's a great list. And I applaud you for that for sure. I'm learning myself how to say yum and yummy to fruits and vegetables again. I grew up on vegetables. My dad had
Mhm.
many gardens around the house. My mom would cook these things and they were good then. And somehow or another, I got away from it, but I'm coming back to it slowly. Everything in moderation, guys.
Yes.
So, yeah, everything in moderation. So, continue to build. Make sure you make it a priority to get your eyes examined and make sure that you not sitting still and allowing certain things that could affect your vision permanently, as we talked about tonight. That's what glaucoma would do. One of the silent killers of vision, steal your vision. Okay. Dr. Lauretta Justin laid out some great information for us, some great advice and tips for each and everybody who's watching the webinar tonight. And I hope that you guys were taking notes. I have notes that I've been taking. I'm learning. And thank you for sharing that information. Really,
Yes.
as we get to these final moments, you can say any final words that you may have. You can also, say what you feel is the key point that you want those who are watching tonight, those who may see this webinar later, to take home with them in regards to their eye health and also about preserving their vision.
And I just want to say to everyone who came and watched, I congratulate you. I am proud of you. And you're definitely ahead of anybody who wasn't here. So you're taking the first step to your health. And because of that, I have a free gift that actually brought just for you guys. And if you visit my website at millenniumeyecenter.com, and we'll bring that website right there on the screen for you. I have an ebook that I wrote that's titled Eat Right for Your Sight. It basically goes through some of the things I talked about in this webinar tonight. So it's free. You can just go ahead and click on the link, put your name, and then you will be able to download the ebook. I have some real fun recipes in there, some detox things that you can do, because I totally believe the things you do will help your eyes altogether. So I've been so honored to be here to talk to you and to share these nuggets with you. I just want you to remember that just because you don't feel something doesn't mean there's anything wrong. And if you're not sure, you don't have to deal with it by yourself. That is why there are professionals out there like myself and Dr. Brown. Our job, we exist to serve you. So you do not have to take this all alone. You can get help. I want you to remember, just because you don't feel anything, it doesn't mean that there's nothing wrong. But when you go get checked, it will give you the peace of mind that all is well.
Thank you. That is a great summary. Thank you for being our fabulous guest speaker. Thanks to all of you who are listening in. We're going to have another topic next month as we continue to have these episodes of Protecting the Vision. Doc, I hope that you have a great rest of the evening. I want to again thank you for your service today. Thank you for being that pillar in communities as you continue your service as an optometrist. We love you, we appreciate you, and we wish you nothing but the best in 2026.
Thank you so much. And thank you, everyone, for watching.
Yes. Thank you guys for tuning in. That's another fabulous episode of Protecting the Vision, our first webinar for the year 2026. And if it's this hot, I can't wait to hear what's coming up in February and March and April with our fabulous guest speakers. And thank you all for tuning in with us tonight. I really do appreciate that. And as we close, I want to thank you for spending time with us and taking an active step towards protecting your vision and the vision of those you love. Education is powerful. That's why we do this. And when we share knowledge, we create healthier families and communities. And as we reflect on the Reverend Dr. Martin Luther King today, we're reminded of his words. His words is, of all the forms of inequality, injustice in health is the most shocking and inhumane. Tonight's conversation is one small but meaningful way we continue his legacy by advocating for awareness, for access to health care and early care. Early intervention is key. So may you leave this webinar feeling empowered, informed, and inspired to see your health and your future clearly. We appreciate you for joining us tonight. My name is Dr. Timothy Brown, board member for the National Optometric Foundation, and it has been my pleasure to bring you another episode of Protecting the Vision. Have a great evening.